Simon Ateba is White House Chief Correspondent for Today News Africa, which covers President Joe Biden, Vice President Kamala Harris, U.S. government, IMF, World Bank, other financial and international institutions in Washington, New York. En March 21, 2023, Ministry Health of the United Republic Tanzania declared a Marburg virus disease epidemic in country. À 22 March, a total of 8 cases have been reported, including 5s from 2 villages in Bukoba County, Kagera District, United Republic Tanzania. 2 of these cases were healthcare workers. 1. This is the first reported Marburg virus disease outbreak in the country. Response measures, rapid response teams have been deployed to investigate and implement interventions in affected areas, including contact tracing and risk communication activities. WHO assesses risk of spread as very high national level, high at sub-regional level, moderate regional level due to cross-border movements between Kagera region and neighboring countries such as Uganda in north, Rwanda Burundi in west. At global level, risk is considered to be low. Description of the situation on March 16, 2023, Ministry Health of the United Republic Tanzania announced that 7 cases and 5s from an unknown disease were reported 2 villages Bukoba County Kagera region northern Tanzania. The cases were later confirmed to be Marburg virus infection by reverse transcriptase-polymerase chain reaction at the National Public Health Laboratory in Tanzania. En March 21, 2023, Ministry of Health officially declared the first MVD outbreak in country. À 22 March, 8 cases, including 5s, have been reported from the Kagera region. The remaining 3 patients continue to be treated. À 22 March, no cases have been reported outside of Bukoba District, Kagera District. The first case detected reported a travel history from Goziba Island Lake Victoria in Tanzania and developed symptoms after returning to her village Bukoba. 4 additional cases were identified from the same family as this index case. In addition, 2 cases were reported, one of which among the healthcare workers who treated them. New information is available on the 8th case. Investigations are ongoing. The reported symptoms of the patients were fever, diarrhea, vomiting, bleeding from various sites, and renal failure. Samples were taken from both and live cases and confirmed for Marburg virus by the National Public Health Laboratory. Epidemiology of Marburg virus disease. Marburg virus disease is an epidemic-prone disease associated with high case fatality rates. It originates from the same virus family as Ebola virus disease and is clinically similar. The current CFR for this outbreak is relatively high at 62.5%. Marburg virus infection is usually caused by prolonged exposure to mines or caves where Rousettus bat colonies live. Healthcare workers have been previously infected when treating patients with suspected or confirmed MVD. Funeral rites involving direct contact with the deceased's body may also contribute to the contamination of Marburg. The incubation period ranges from 2 to 21 days. The illness caused by the Marburg virus begins abruptly with high fever, severe headache, and severe weakness. Around the 3rd day, severe watery diarrhea, abdominal pain and cramps, nausea and vomiting may begin. Severe hemorrhagic manifestations may occur 5 to 7 days after the onset of symptoms, and in fatal cases some form of bleeding, usually from more than one site, is observed. The clinical diagnosis of MVD in the early stages is difficult because the symptoms are similar to other febrile diseases. Differential diagnosis for MVD may include other filovirus diseases, Lassa malaria, typhoid fever, dengue rickettsial infections, leptospirosis, and plague. Laboratory confirmation is primarily done by RT-PCR. Other tests may be used, such as antibody capture enzyme-linked immunosorbent assay, antigen capture detection tests, serum neutralization tests, electron microscopy, and virus isolation by cell culture. Although there is no vaccine or antiviral therapy for MVD, supportive care such as rehydration with oral or intravenous fluids and treatment of specific symptoms improve survival. A number of potential treatments are being evaluated, including blood products, immune therapies, and drug therapies. This is the first time Tanzania has reported an MVD outbreak. Although there is an ongoing MVD outbreak in Equatorial Guinea, So far there is no evidence of an epidemiological link between the two outbreaks. Other MVD outbreaks have previously been reported in Ghana, Guinea, Uganda, Angola, Democratic Republic of the Congo, Kenya, and South Africa. Public health intervention rapid response teams have been deployed at regional and county level to investigate and implement response measures. Contact tracing activities have been implemented to monitor people with similar symptoms in the community and health facilities, including contacts of known cases. En 21 March, a total of 161 contacts were identified and 140 were followed up and followed by healthcare professionals. Risk communication activities were also initiated in Kagera region to give health awareness training and prevention messages. WHO risk assessment. The United Republic Tanzania reported its first outbreak of MVD, a highly lethal disease with a mortality rate up to 90%. The affected area borders Kagera, 3 countries and Lake Victoria, and cross-border population movements may increase the risk of disease spread. Also, Marburg virus has been isolated from fruit bats in Tanzania and neighboring countries to affected Kagera region, so the same bat species may carry virus in this region. Ebola virus outbreaks recently emerged in Democratic Republic of the Congo from April 23 Juillet 3 and Auguste 21 to September 27, 2022, and following Sudanese Ebola virus outbreak in Uganda from September 20, January 11, 2023. In the West African region, an MVD outbreak was declared in Equatorial Guinea on 13 February 2023 and is ongoing. Based on available information, risk is assessed as high subregional level, moderate at regional level, and low global level. WHO advice human-to-human transmission of the Marburg virus is primarily associated with direct contact with the blood and/or other bodily fluids of infected persons. Healthcare-associated Marburg virus transmission has been reported in previous outbreaks where appropriate infection control measures were not implemented or were inadequately implemented. Healthcare workers caring for patients confirmed or suspected MVD should implement additional infection prevention control measures in addition to standard precautions, avoiding contact with surfaces and objects contaminated patients, blood, other bodily fluids. Surveillance and detection activities, including contact tracing and active case finding, should be strengthened in all affected health zones. Measures taken to contain MVD outbreaks include prompt, safe, dignified burial of the deceased, identification of people who may have had contact with someone infected with the Marburg virus, and monitoring their condition for 21 days, separating healthy sick people to prevent further transmission. Caring for verified patients and maintaining good hygiene and a clean environment. Raising awareness of risk factors for Marburg infection and preventive measures that individuals can take reduce human exposure to the virus are key measures. Reduce human infections and WHO encourages all countries to submit samples to a WHO collaborating center for approval. Based on the current risk assessment, WHO advises against any travel and trade restrictions with the United Republic of Tanzania.